Ottawa wanted social media celebrities to warn teens of the risks of vaping. Health Canada is looking for a contractor to develop, implement and report on a national vaping awareness program, including finding social media influencers that teens might be willing to listen to. The Canadian Tobacco, Alcohol and Drugs Survey from 2016-17 found 23% of students in grades 7 to 12 have tried e-cigarettes, up from 20% in 2014-15, Stevenson, The Associated Press. Canadians look for information from a variety of sources, and youth in particular are more likely to engage with other influencers beyond government or health professionals, said a spokesperson from Health Canada. One of the goals of the contractor is to find social media trendsetters with a lot of followers and influence who can encourage youth and young adults to attend events and spread Health Canada's message online about the risks associated with vaping. The search for a contractor comes just 1 month after the federal government passed a new law formally legalizing and regulating vaping, or e-cigarettes, which also aims to stamp out any lifestyle aspects of vaping that might appeal to teens. Article continued below. The Tobacco and Vaping Products Act prohibits the sale of vape products to minors, bans flavors aimed at young people and prohibits marketing that features testimonials, health claims or lifestyle themes. Read more. Edmonton Public School Board trustee looks to add joints and e-cigarettes to school smoking restrictions. Feds hope legislation makes vaping's appeal go up in a puff of smoke. Health Minister favors warnings on individual cigarettes as Ottawa outlines tobacco plan. It also allows the legal manufacture, import and sale of vaping products, both with and without nicotine. Finding online celebrities won't be the contractor's only job. In fact, they will be responsible for developing a strategy and plan for a national marketing events program and for developing, implementing and managing the awareness campaign. Article continued below. Top stories in your inbox. For the day's top news from the Stars award-winning journalists, sign up for our daily headlines newsletter. Health Canada considers vaping products to be harmful, although not as harmful as smoking cigarettes. It is concerned about the particular appeal of vaping to teens and its potential to promote tobacco use. And the department says there is clear evidence that exposure to nicotine adversely affects cognitive function in the developing brains of adolescents. The Canadian Tobacco, Alcohol and Drugs Survey from 2016-17 shows 23% of students in grades 7 to 12 have tried e-cigarettes, up from 20% in 2014-15. 10% of students, or 206,000, had used an e-cigarette in the previous 30 days, an increase from 6% in 2014-15. For those who had used e-cigarettes recently, 17% were also cigarette smokers, 12% were former smokers, 35% were experimental smokers or puffers, and 36% never smoked a cigarette, not even a puff. The national vaping campaign will target youth aged 15 to 18 and non-smoking young adults aged 19 to 24 to help them understand the risks and to help parents and teachers with resources they need to have conversations about the health risks of vaping products. Health Canada says the contract is expected to start in the fall.